Welcome, everyone. I am Dr. Catherine Y. Brown. Today, I am so excited to introduce you to Amy Chybowski. Welcome, Amy.
Thank you. I'm so happy to be here, and thanks for including me in this really wonderful project.
Oh, thank you. I'm sending you a virtual heart.
I got it.
Can you share with our viewers where you are joining from and a little about your background? Just who is Amy?
Yeah. I'm joining you all from Madison, Wisconsin. I am a nurse practitioner, and I work for the University of Wisconsin. I've been a nurse since 2005, and I've been a nurse practitioner since 2012. And I've cared for patients living with PH as a nurse and now as a nurse practitioner.
Oh, wonderful. How did you get started? Did you know you wanted to start working in PH? How did you begin your PH journey?
Yeah, I worked in one of the intensive care units at the University of Wisconsin Hospital. And one of the physicians, actually, the physician that I work with now in our PH program, he started the pulmonary hypertension program at our organization about almost 20 years ago, I think. And as part of some individuals living with pulmonary hypertension's journey, they're initiated on therapies that require them to be in the hospital to start those therapies.
Mhm.
And so I was a bedside nurse, and that was my first time ever hearing about pulmonary hypertension when a patient was admitted to start that therapy. And I really enjoyed hearing people's journey and excited about, then I came to learn about all the different treatment options. And once I became a nurse practitioner, I wanted to continue that work. So I did work for a short time in the ICU as a nurse practitioner. And then I asked the doctor that I work with if he would ever want to add a nurse practitioner to his pulmonary hypertension clinic. And so, yeah, so then I transitioned from the intensive care unit to more of the ambulatory or clinic setting. And that was almost 10 years ago. And so I have a really unique and fun role at our program in that I see patients in clinic from, first newly diagnosed to obviously follow them over time. And then if our patients are ever needing to be admitted to the hospital for whatever reason, then I also help to manage their care while they're in the hospital.
Uh, Amazing work. I'm not sure that everyone understands the kaleidoscope of compassion and care that's required, because you said three different things, and I actually experienced that with my mother. You see them in clinic when they come in, they're just standard follow-up treatment, and then that journey, right? So what is that like for you? Specifically, like when a patient is hospitalized, because that's a different pivot, and how you have to advocate for them in terms of, like, you see them when you're doing rounds, but then there are other people that are part of their healthcare team that may not be as versed in pulmonary hypertension care as you are.
Yeah, that is totally true. I think, I've worked with individuals living with PH for so long now that I sometimes forget, right? Because I see it every day. I
Yes.
forget that not everybody does. And I actually enjoy that part of my role as well, because I have you kind of become known as like the PH person, like at your program. And so I get the opportunity then to really teach other nurse practitioners, physician assistants, the bedside nurses that, care directly for the patients, and also medical students, residents, fellows, and even some attending physicians who, just don't have the expertise that I've been able to gain because of all the years I've been doing this work.
Mhm.
What I really love about my role in helping to care for patients across that spectrum or that kaleidoscope that you mentioned is being a familiar face and a piece of continuity because obviously if somebody is being hospitalized for whatever it is, there's something that's changed, something that's different, and that's really scary. And so I obviously take care clinically of what we need to get things done, but I really enjoy being able to come in and just sit down and talk about what we need to talk about, but then really just check in and make sure in the care that we're providing, it's beyond just the physical things that are going on with the patient, but checking in with how it's feeling and making sure we're addressing that, because it's so important. And oftentimes, I think healthcare providers just don't have the time or connections with patients to be able to do that.
Absolutely. Do you think it is like a specific in-service that we need for, kind of caregivers across the board of, what is pH, what are different pumps? What is it that we need? And I only ask that, Amy, because that is a common theme that I'm hearing as I do these podcasts. There's a disconnect that happens. So what do we need when we're looking at medical professionals?
Well, I think that obviously there's a lot of major pulmonary hypertension programs across, the country. And, even within those organizations, there's going to be people who aren't familiar with the, diagnosis or management and things like that, but they know that they have resources right there to go to, but I think where, an area that we can really tap into to try to extend that beyond our own facilities is, going to and visiting other, smaller programs or other community hospitals, or even paramedics, or EMTs, right? Because I know, the patients that I care for, they're obviously taught to be, and I think all PH patients are taught to really be advocates for themselves, because they'll probably come across people who are I have no idea what that is. And that's okay to some degree. We can't all know everything, but it's also not fair to a person to always have to re-explain their story and their journey. And I think that the more we can extend the network of, pulmonary hypertension experts, like clinicians, nurses, pharmacists, whatever you are in the world of pulmonary hypertension, being able to extend that out so that people will then know oh, I've heard about that, or, oh, I know we don't have the resources to maybe provide the care, the right appropriate care for this patient here, but I know who I can reach out to. And so I think we have to continue that work of reaching out to other programs, other facilities, other healthcare providers to be that bridge and that advocacy for individuals living with pulmonary hypertension.
Absolutely. You mentioned something that, again, I want to pull out, the fact that patients and their caregivers in many instances have to be advocates. They have to be educated on how to use the pump, the medication, all of these different things. What is that process like for you when you're educating patients and caregivers on how to advocate for themselves? My daughter was very young, but all of my children had to know how to work my mother's pump. They had to understand that, this is where we keep the medication. This is what it looks like. Don't touch the ice packs. I mean, all of these different variables of things and what that looked like. So maybe share with people that process, because it's not like many other diagnoses.
Right. And clearly when a person is diagnosed with pulmonary hypertension, that's a very overwhelming time. And what I've learned is to not expect to be able to share everything in one setting. It depends a little bit on what type of situation you're in, if a person you're meeting in the clinic and you have some time to, get started on therapies, that initial teaching and education is going to look different if compared to somebody who is really severely ill and in the hospital and, getting the diagnosis, where you might be talking about starting those pumps right away and they haven't even had time to absorb all the information about this diagnosis. So I really try to meet patients where they're at, and I'll use signals from them as we're just talking about, first and foremost, okay, what is this? Like trying to explain it using pictures, using videos. There's wonderful, resources for education. So people living with PH and their caregivers can understand what exactly is going on in their body. And then I move into, the treatment options. And we talk about the 3 different classes of tools, of medications that we have to try to treat pulmonary hypertension. And that might be a time where I'm sensing, okay, we need to just kind of put it on break. Let's take a break. We'll revisit that later if we have the time to do that. And I have pump demonstration pumps that I can show the individuals, show their caregivers. They can, touch it, feel it. That's I think a picture or a visual is often like worth 1,000 words. So being able to actually physically being able to look at what we're talking about. And then the whole time we're talking through, okay, this is the diagnosis, this is the treatment options, this is our recommendation for what we should do for you. Being able to continue to check in with myself and meeting them where they're at. And I always share, like, with people I'm talking with about anything, but especially when it comes to these really quality of life implicating therapies, when we're talking about the infusion therapies, you're the boss in your journey. I'm a part of this journey to help you break down the information and make sure you understand what's happening with your body and what your options are. And we'll give you our recommendation, but ultimately, if an infusion therapy isn't going to match with somebody's values for what they like to do in their day-to-day life, or it is just it's too overwhelming for them at that time, then that's okay. Then we start with what feels good for them.
Mm-hmm. Beautiful, beautiful. And I love how you explain that listening to the patient and what works for them and their lifestyle, because really we're talking about quality of life. It may not look the same, it may look different, but they still have a voice and a say in what that looks like. I love it. Now, I know people watching this around the world, they've heard different definitions of how people define pH, but you're an educator and you do this all the time. So for someone who's watching who says, Amy, I still don't know what it is, how would you explain pulmonary hypertension?
So pulmonary hypertension is high blood pressure in the blood vessels of our lungs, and it's different than when a person has high blood pressure, which they might be on medications to lower that blood pressure. There can be a lot of different reasons or causes why a person may have pulmonary hypertension, and therefore there's a lot of important steps along their journey to make sure that we know what kind of pulmonary hypertension a person has, so then we know what the right and safest treatments are for them. Pulmonary hypertension causes a form of heart failure, right-sided heart failure, because the pressure in the lungs has made the right pumping system of the heart have to work a lot harder to pump blood through those blood vessels. And because our heart is a muscle, if it's working harder, it's going to get bigger. And then as time goes on and that pressure still is there or getting higher, then that pumping system can't effectively pump blood the way it should. And that causes a person to live with heart failure symptoms.
Bravo. And you've heard it right there from Nurse Amy. What advice would you give to someone like me who's on this journey to interview 100 people. But maybe for someone who's, newly diagnosed, just the community in general, what words of wisdom or advice?
Yeah, Dr. Brown, I mean, this is such a wonderful project that you're doing. And I know we've just met each other for the first time, and I did not have the pleasure of knowing your mother, but clearly she was a wonderful person and raised a really wonderful human being. So thank you for doing this work for our community. When I meet people as a clinician and, gain relationships with them over time, that's really powerful, I think, for them, for me, but I also realize that I don't understand what it's like to be in their shoes completely. I don't have pulmonary hypertension. My loved one doesn't have pulmonary hypertension. And I think there's a lot of power in being able to connect with other people living with PH and their caregivers in support groups or, online, many ways to connect with other people, because I think it can feel, at least for my observation sometimes, is it feels very isolating for people. And of course, you have the relationship with your healthcare providers and your PH team, but to have that other avenue of just like talking about what life is like and what, when you did this, how did that feel? What did you do? What tips do you have? Those are just the little areas that I don't have that piece of information to give them because I haven't experienced the journey that way. So I think my advice is, if a person is feeling isolated or needs a little extra beyond just what their medical team is providing, like consider, reaching out to support groups or other individuals on the journey who they might really be able to complete that piece of the puzzle for you.
I love it. I love it. Beautifully said. Is there anything that you want to share with patients, caregivers, medical professionals, the community, anyone watching at all that I have not asked you? And I've asked you a lot, but anything at all that you want to share?
You did a good job, I think, of covering kind of all the different aspects of pulmonary hypertension. But I think that I just want to continue to give people hope, because I know that receiving a diagnosis of pulmonary hypertension is very scary because we don't have a cure yet, but we have really great therapies that can make a person feel a lot better and have a really good quality of life. And there are so many expert, like wonderful researchers out there that are working as we speak to develop more therapies and better therapies, and at some point a cure.
I love it. And you said hope, and our mantra is awareness, empowerment, and hope. Together, we can make a difference. So I love that you brought up hope. Well, Amy, I hope this is not the last time we get an opportunity to have you join us. And once I hit that 100, I'm going to send you a message and said, Amy, we did it.
I can't wait for that.
Well, thank you again for being here. And for those of you all watching, please share this message, like it, and let people hear all the great information that Amy had to share with us today. She is definitely, as you've heard it, a knowledgeable healthcare provider who is passionate about the work of pulmonary hypertension. And for that, we just say thank you. And thank you for being our PH hero for the day, Amy. So until next time, everyone, I'm Dr. Catherine Y. Brown, your host. Be sure to continue to watch the journey. Sending a virtual heart. Thank you again, Amy. I appreciate